We began with a situation probably, I don't know, 100 years ago or maybe more, where the number one cause of death was related to childbirth. And it's still not negligible as a cause of death of young and middle-aged women. But we started with that situation and thankfully have developed a large number of abilities to detect risk and to intervene and to prevent the death of mothers and children. Where we get into problems is when we decide that other women than those who are clearly indicated to need them need to have interventions.
When you're having a baby, there's nothing really wrong with you. You're not ill. In all of the experiences that you have in your lifetime, having a child is one of the most miraculous and amazing times. And I'm so saddened by the amount of fear and trepidation and concern and worry that surrounds that event.
Care that's impersonal and mechanized and focused solely on a risk-based model really tells a woman that the process is faulty, that she's just a number in the process, and doesn't promote her participation in her own health care.
Midwives and family doctors primarily are the providers that we've seen in the research have the best outcomes.
Birth is a normal process, and then what we do as midwives is support that normalcy.
From the midwifery model of care, safety means less intervention, more personalized care, more individualized care.
As little intervention as possible in a quiet way, letting a woman come to her own birth experience in a safe way, but in a watchful way, as opposed to intervening along the way.
You do not need somebody with the skills of a board-certified OBGYN to do a normal vaginal birth.
The United States is the only industrialized country in the world that uses surgeons to attend normal childbirth.
And then we look at those other countries and we see that their healthcare costs are lower, their perinatal and neonatal outcomes are better.
The midwives do generally a better job with the average patient of getting her to delivery without interventions and without complications.
Most maternity practices that are commonly used in the hospital were never designed to be used at the frequency that we're seeing them used now. And none of the evidence supports this. A vast body of literature does not support the use of labor induction, epidural anesthesia, for instance, or cesarean section at the rates that we see it currently being used.
If you get an induction that's unnecessary and you're not really in labor, there's a 40% chance that you will end up with an emergency section.
Today, the cesarean section rate in this country is 31%.
C-sections are the most commonly performed operation in the country right now. We've gone so far off course in our prenatal care and in our public policy messages that most women don't think they can deliver a baby without technology-driven interventions. And we know certainly that that is just not true.
(1008).
Mrs. Moore's contractions are more frequent, Doctor.
Good. Take her into the fetus frightening room.
Right.
Jolly good. It's a bit bare in here today, isn't it? Yes. Yes. More apparatus, please, nurse. The EEG, the BP monitor, and the AVV.
Yes, certainly, Doctor.
And get the machine that goes bing! And get the most expensive machines in case the administrator comes. Lovely, lovely. Jolly good. That's better. That's much, much better. Yes. More like it. Still something missing, though. Patient. Yes. Where's the patient? Anyone seen the patient? Patient.
Ah, here she is.
Bring it over here. Mind the machine.
Sorry, Dr. Spencer.
Come along. Come on.
Jump up then. Up.
Hello. Now, don't you worry. We'll soon have you cured. Leave it all to us. You'll never know what hit you. Goodbye. Goodbye. Drips up. Injections.
Can I put the tube in the baby's head?
Only if I can do the episiotomy.
Okay.
Okay. Legs up. Okay, come in. Come on in, Olga. That's it, jolly good. Come on. Spread round there. Who are you?
I'm the husband.
I'm sorry, only people involved are allowed in here. Right.
What do I do?
Yes?
What do I do?
Nothing, dear. You're not qualified.